Ankle pain can be caused by a variety of reasons. There may be a pathology within your ankle joint, or sometimes a pathology around your ankle joint in some other parts of the foot that are giving you an indirect symptoms in your ankle. I'm afraid the best way to find out whether it needs surgery is to be assessed by a experienced clinician, usually a surgeon, to assess and investigate as appropriately to work out what sort of treatment might be required, and that may or may not be surgery. So ankle fusion or replacement are end stage treatments of end stage ankle arthritis. Both the procedures are equally good in improving the symptoms from the ankle. They have both got their own pros and cons. Ankle fusion used to be a gold standard operation for many years. However, over the last 10 to 15 years, the ankle replacements have come a long way and they boast equally good responses. One of the decision making elements is your age and your activity level. Ankle replacements are no good if you are a runner or a high impact activity person because it's a machine if you think about it and it will wear out. Ankle fusion, if you fuse the ankle joint, the other joints can get arthritic. There is increasing research that is telling us that. So the choice whether you have a replacement or a fusion at the end is yours, but the good elements are your activity level required, the level of arthritis in the other joints, that will help sway which one side or the other. There is a very good website, which is a national website called TARVA, TARVA, that gives you a very unbiased information regarding both where the patients can make their decision. Plantar fasciitis is one of the most common problems people feel in their foot and ankle. Um, the pathology can directly be in the heel or it can be from away from the heel. Most of the pain in the plantar fasciitis is because of the mechanics of the foot and ankle, and that needs to be addressed. That is usually addressed by physiotherapy or some orthotics and insoles, for example, footwear modification and activity modification. Surgery has a limited role indirectly for plantar fasciitis. However, the surgery can involve lengthening or loosening the Achilles tendon because that sometimes contributes to it, or it can be for a local pathology. However, it's very limited use for local pathology. There are other treatment options such as injections and shockwave therapy that have been found to be quite useful, yet they are non-surgical. But it continues to be a difficult problem to eradicate. So flat feet are a normal variant of a lot of feet, so they are not abnormal. However, if your flat feet are causing you pain in the foot, then it becomes abnormal. And does it require surgical intervention? Again, it's a very difficult question to answer unless assessed. However, most flat feet can still be very well managed by a well-fitting orthotic, i.e. an insole or footwear modification. It's only when these non-operative treatments are not that effective, then a surgical intervention is required. And it depends on individual symptoms and progression of the disease and how much it interferes with your day-to-day activities. Uh, Swelling is common in foot and ankle if there is some sort of abnormality within the foot and ankle. It can be as a part of a general body swelling, like people having heart trouble and things. However, if you've got a localized foot problem, arthritis, or an injury, for example, yes, that will give you a swelling. Numbness and tingling, yes, generally speaking, they are very relevant to, they are very what we call a nerve symptoms. And again, they can be because of a local problem, especially if it's been from a trauma of some description, or it can be part of a generalized neurological problem that your body has. I believe at the end of the day, if you have got substantial symptoms, either one of them, and they cause substantial disability, and then it's best for that to be assessed by an expert or a clinician who can try and justify why the cause is, and then investigate it appropriately to look at the various causes and try and get to the bottom of it and deal with it. But it's impossible just to say on the outset, you've got a swelling, this is it. It will need a formal, proper assessment.